Hey, everybody. Welcome to our Insider's Perspective interview series. I'm Brianna, your host. And as you know, Nurse Deck is built on the collective nurse voice. Today, we are welcoming the voice of Dr. Sylvain Brousseau. Dr. Brousseau serves as president of the Canadian Nurses Association and has over 3 decades worth of clinical and educational experience. His current role as an associate professor and slash researcher focuses on both nursing governance and socio-political leadership. So, Dr. Brousseau, welcome and thank you for making the time for us today.
Thank you very much, and it's a pleasure and honor to me to be here today with you. Thank
Awesome.
you.
So, let's start from the beginning. How
Mhm.
did you find your way into the nursing profession? What made you decide to
Oh,
get into nursing?
oh my God, this is a great question because you bring me back in 1986 when I start as a not as a nurse but as a nurse. I think you call it. There is so many way to call it, nurse's aide, or it's
Hmm.
or
Assistant, or
yes,
yeah,
personal health worker, to do the care base to help
sure.
nurses, and I was I was working in this area, and my chief nurses where I used to work on the unit says to me one day, because I was always saying to them, okay, the IV is not correct. Going to see the nurse. Oh, I think maybe we could do that. Oh, the patient has this kind of problem. Can we look at it? And she
Yeah,
said, Sylvain, how come you didn't go to study in nursing? And I
yeah.
said, oh, okay. And she said, the way you are talking to the nurse, the
Mm,
way you always be in the front to help the person, you
hmm.
always make differences in the unit, and you're always there to empower others. I said,
Mm,
and it seems that you are very passionate about what you do. And I
hmm.
said, well, okay, I'm going to do all the process, because here in Quebec we have the two, because I'm from the Quebec provinces in Canada, and we have two entry to practice, and we still do have the same today. And it's the college degree or the baccalaureate degree. And I
Right.
went to the college degree to get my diploma,
Hmm.
and that's where it starts. And even the first year of my courses, it has been challenging for me, because going back to the school, and all of this, all the learning, how to understand all the technical words,
Mm,
and finally to finish. And even at the end of my college degree, André Despins, and now she passed away 2 months ago,
mm,
told me in 1993, she said, Sylvain, you will go far away in the nursing profession. And I didn't respond to her, because I
mm.
said, oh, why is she telling me that?
Yeah.
And and now I contact her I would say 6 months ago, and I find it on Facebook, and I ask
Hmm.
her, "Are you André Despins?" Blah blah blah, she said to me, and yes, she said, "And I'm following you, Sylvain." I was like, "Oh
Oh,
my God, yes,
yeah.
uh,
Oh.
yes," and I said, when you told me that in 1993 in April, because it was the end of it's not the theoretical courses, it's the training
Hmm.
in the hospital, that I was evaluated by her. And I said, do you remember? She said, I remember perfectly.
Yeah.
And I said to her, oh my goodness, are you how do we say, someone that can see far away? But
Yeah.
she said, because the way I was, the way I'm people say that I'm humble.
Hmm.
I always ask questions. And I always want to learn, to
Hmm.
understand, to discover. And because I'm curious, and because I like what I do, I love my work. I have to
Mm,
say that I'm a passionate nurse, and I'm trying to transfer this passion to my student also.
hmm.
And that's why we start today, 20 years, I would say even near 40 years ago,
Mm,
when I was working at St. Luke Hospital as a nurse's aide, and then I become a
hmm.
nurse. And I wanted to make a difference to people's work quality of work life,
Mhm.
and to help the person to improve themselves, prevent injuries, providing the most rigorous care, and not doing things without asking question,
Right.
or and recognize that I'm not a perfect person. Even sometimes if I'm perfectionist about what I
Mhm.
do, I can make mistake. I'm
Mhm.
trying to do everything to not making mistake,
Mhm.
and I love to do the direct care to the patients,
Mhm.
and that's why I decided to do, and because I recognize the nursing profession as a scientific profession, as doctors and or physician or physical therapist.
Mhm. Yeah. It's interesting that even early on, you were not just focused on patient care, but your coworkers around you and how to improve on both experiences, the patient and the nurses. I think sometimes that comes to nurses later on in their careers, but it sounds like for you, it was an early recognition of that's where your interests were.
Yes, and I think that's why I've decided to go in the nursing profession. But to be honest with you, never in my mind, because when she said that to me, I said, "Oh, I didn't say." I said, "My, is she right? Am I?"
Yeah.
And it never came to my mind after that. I start to work, and it's in the course of what happened after that probably will bring me where I am today. But
Mhm.
it was not planned in my career life. So I'm
Right.
going to work as a direct care nurse all of my life, and as long I'm doing an excellent work. And
Right.
for me to be a nurse, it's not a job;
Yeah.
it's a
Right.
professional work.
Yeah.
It's not task. It's a role
Right.
and responsibility.
Yeah.
And at the time, I would say, like, I don't say like 30 years ago, it was the environment was perfect, but it was different, and we
Mhm.
did have time at 30 years ago to take care of the patient
Yeah.
compared to what we are going through today in the
Absolutely.
different healthcare system. It changed dramatically with all the reforms over many years,
Mm.
and yeah, and
Yeah.
the nursing governance over the year, unfortunately, yes, it's evolved because nursing has to be to evolve, but in a way, it's like if the healthcare environment it's evolved also, but the way we do things, it's like if for some reason that I don't understand, we still in the way we manage for some places
Mhm.
in the
Mhm.
60s or in the 70s that we would be, and now we know that we it's important that we the healthcare environment
Mhm.
become more a place to that where you like to work on.
True. Yeah, especially with the big problem of trying to retain nurses right now. That's a huge
Hmm.
issue that we deal with in the States. So, sounds like
In,
it's a common experience for you
yes,
as
indeed.
well.
Yes.
So tell us how you got from you became from the nurse's aide to deciding, okay, maybe nursing school is something I should look at more seriously, and then now as your role as a professor and in nursing leadership, how did you get from that point A to point B there in your career?
Okay. Point A to point, I would say to Z, because I mean,
Yeah,
not to
right.
Z, no, not to Z, because we still have things to do. But I think it's all about professional nursing engagement in respect to our conviction and having the courage to move forward instead of staying in the same status quo. I'm someone that I don't like to, yes, I can work as I think it's, I like to move forward. I don't
Mhm.
like the status quo, as I said. And over the
Yeah.
years, I found out that it is essential that as a nurse, we make a difference in the healthcare system and in
Mhm.
the nursing profession. I also believe that we must be engaging and involving on different decision table. That's what I
Mhm.
learned over the year. I
Sure.
said everyone is deciding for us. I think it's
Yeah.
time that we decide for us, but also for the patient.
Yes.
And
Right.
and over the year, after my college diploma that I finished in 1993 in Montreal, then I went to the Ottawa University. A few years
Mhm.
after that, I said to myself, oh, I need to learn more to get more tools in
Mhm.
order to improve my nursing intervention. I said I need to do my bachelor degree, and then I was working in the hospital, and then I went to work at the home healthcare services because we do have a public health for
Mhm.
the home healthcare, and I've decided to work in this area, community health. But
Mm.
in order to be able to work in this area, I had to do my bachelor degree.
Mm.
And I
Mhm.
said, "Bon, am I doing it in Quebec or I'm going in Ontario?" And I've decided to drive few days a week in Ottawa from
Yeah.
Montreal. It's about 1 hour and a half or
Yeah,
two
yeah.
hours to do my bachelor degree. And I've done it in English. It was a challenge for me.
Yeah.
I passed
Can
this,
imagine.
and at the end of my baccalaureate degree, I fell in love. You know what? With what? With courses regarding nursing theory and
Yeah.
nursing research.
Mm.
And even my professor says to me, Madame Ferrand, I remember her name, she
Mhm.
said, Sylvain, and she also said you will go far away in nursing research. And I said, no,
Mm.
no, I'm doing my baccalaureate degree
Mhm.
because I want to do something else. I want to work in other area of practice,
Mhm.
such as community health. And then in 2003, a year after I finished my baccalaureate, then I decided to do my master degree. And I was
Mhm.
still working all the time.
Mhm.
Always when I used to study, I was still working in direct care patient.
Mm. Mhm.
And after that, when I finished my master was about male in nursing and the quality of work life, because we didn't have any much data about it.
Mm.
And after that, I said, well, that's finished. I published also an article regarding my master's research result findings.
Mm.
And after that, I've decided to go to do my PhD.
Yeah.
And because I starting to see that nurse managers, what is their quality of work life?
Mhm.
Some of them are leaving the profession.
Yeah.
Some of them are decide to say no. Administration or management, it's not for me.
Mm. Mhm.
And then I said something is happening. How come we don't have enough, or why the new nurses or the nurses doesn't go in this kind of area of practice?
Right.
There is something that it's, and I started to look at the literature review, and I said something is happening. And I
Yeah.
said that's concerning, because if we
Yeah.
don't have enough nurse managers
Mhm.
in leadership position, that's going to weaken
Yes.
our governance and
Yeah.
our power.
Right.
And I said I have to explore and understand qualitatively and quantitatively, because I've done a mixed method studies to what
Mm.
is the quality of work life
Right.
of nurse managers here in Quebec. And then I finished my PhD in 2015. But in meanwhile, when I was master's and PhD. When I finished my baccalaureate, that's where I've decided to engage in nursing
Mm.
profession. That's why I engage in different governance board of nursing, such
Yeah.
as our regional nursing board. I've been on the regional nursing board of the Laurentian for about 13 years,
Mm.
chair of different committees,
Yeah.
and I have learned. And at the time, I have to say, I'm a shy person. And yes, I am. I
I'm
like
just remembering looking at the list of organizations you're a part of thinking, wow.
yes, I am, but I like challenge. And that's why probably I've decided to engage in those different
Mhm.
board. And I've been, as I said, on the regional nursing board up north of Montreal. After that, 2 years on the Order of Nurses of Quebec,
Mhm.
and also after that on the Laurentian Nursing Commission. Because
Mm.
I think what I discovered being on this table, if you're not there, who will decide, who will bring
Yeah.
ideas, solution,
Right.
and awareness, because it's important that you are aware of all the evolution of the nursing profession.
Yeah.
And that's what I find out, that nursing was a bit not saying that they were being removed or if evicted from different
Yeah.
table, but I said we don't see much nurses. I said no, it's important that we're there.
Yeah.
And after that, after finishing these, I was doing my PhD. I went to ICN conferences. I didn't know what it was in the International Council of Nurses because Quebec was not part of CNA for about 35 years.
Mm.
Okay. We've been out because of political and other issues. And I said, oh, ICN, oh, Nursing Association.
Mhm.
I looked to Canada and I said, in each provinces, there is a nursing association. The only province who doesn't have any, it's Quebec.
Yeah.
And I said, well, I said, I'm going to ask colleagues from different area that I know
Mhm.
because it's important that you understand who are your opponent, who
Mhm.
are your allies, you know.
Yeah.
And I said, that's what I learned over the year, as being on different board. And I said to my colleagues, I said, can we have a meeting in my home, in my kitchen home? And
Yeah.
we discussed about, is it relevant to have a nursing association in Quebec, knowing that we have a union,
Mhm.
and even the union is not a nursing union anymore because it's in
Mm.
a more international interprofessional union now. Like
Right.
it's you will find different. Yes, nursing profession is there, but other
Right.
profession.
Sure. Oh,
A-
interesting.
yes, and I said, but okay, we have that. We have the order of nurses that we don't represent the nurses. They protect the public.
Mhm.
The regulatory body don't represent the nurses. And I
Mhm.
said, is it relevant that we create a nursing association?
Yeah.
And people said yes, but Sylvain, don't go too far. I think we have to start with a group. And me, I
Mm.
was like, why don't we have a nursing association? I think we are time to have that in Quebec. And they
Yeah.
say, yes, but Sylvain, go slowly because this is kind of new. I said, okay, we will go to develop a group that we developed that we call RAPIC. It's the group of, if I translate from French to English, it's the a group of the future of the nursing profession in Quebec
Okay.
that's in 2014. In 2017 has been transitioned to the Quebec Nurse Association,
Mhm.
and I was the chair of the RAPIC, and I was a transition chair of the Quebec Nurse Association because after
Mhm.
4 years, I think I worked with my colleague, and you don't when you co-create or you co-found, you don't do it alone. You
Right.
do
Right.
it collectively. I always say
Yeah.
that alone you don't go far away. You go
Yeah.
far away when you are surrounded and you
Yeah.
are supported with others.
Yes.
And that's what I call collective leadership. And we've
Mhm.
developed the Q&A, Quebec Nurse Association, and because some people on the Quebec Canadian no the Canadian Nurse Association knew that I've developed this, they came to me in 2017 asking me if I would like to submit my name with why I would like to become a part of the Canadian Nurse Association, to be part of the membership, not a membership, but being part of the board.
Mm.
And
Mhm.
then I said, okay, let me think about it. And then I've decided to submit my candidacy, submit my philosophy of thought,
Mm.
my statement. And then I've been elected in 2017, bringing back Quebec on the table on the federal
Mhm.
level. After, I would say, some people said we had someone in the last one was in 1988.
Oh,
And
wow.
yes, and then I bring back Quebec, and it was a 2-year mandate as board of director. I've been as independent Quebec board of director for 2 years, and then in 2019 I finished my mandate, and in October, I remember the date, October 28th. My phone, my text, someone texts me and say, Sylvain, why don't we gonna have election to the Canadian Association for the president-elect? Why don't you submit your candidacy? We will support you. I said, Are you sure? I mean, Quebec doesn't. Quebec has to vote because the structure was, it was like each province and jurisdiction who has a number of vote depending of the
Right,
members that
right.
they have. Now it's all changed because we have to change all the structure because what it all the association and orders, regulatory body has been split, and we have to change. Now it's not. Now it's independent. It's individual membership now. It's not like it was.
Mm,
And I said, but I mean, Quebec has to vote, okay, and we will help you to promote your candidacy, your campaign.
yeah.
I said, give me 3 weeks to think about it because I mean, and finally, I have support of my university, support of my some of my ex-colleague of RAPIC and Quebec Nurse Association said, I'm going to give you a letter. The national director of nursing of Quebec, she wrote me a letter to support. And I also have support of the president of the Saskatchewan Registered Nurse Association at the time,
Mm,
and who mentored me when I arrived
mhm.
in 2017 on the Canadian Nursing Association board. And even the past president, Barb Shillun, she said, yes, Sylvain, we think that you will be a great leader on this position. And I said, okay, let's move
I'm in.
forward.
Yeah.
Yes, I said, Sylvain, take your courage with your two hands. And it's challenging for me because I'm francophone, and as Quebec has been out for 35 years.
Yeah.
And I said, you're really sure? She said yes. And I said, okay, then I will submit my campaign. And I've done my campaign. Naturally, the pandemic arrived in the same time in March 2020. What a funny, not funny, but
Right.
strange 2 years. I mean, in 2020, it was like, oh boy.
Yeah.
And yes, and I've done my speech. I gave my vision, and clearly said our profession is at a crossroad at the
Mhm.
time. And now
Mhm.
I'm finding out that it's true.
Mhm.
And now I've been president elect for about 2 years, and since
Yeah.
April 1st, I'm the 52nd president
Mhm.
of the Canadian Nurse Association, and the second francophone from Quebec after 64 years.
Wow.
The first francophone of Quebec being president, it's in 1958. It was Ali
Wow.
Girard from the faculty. She was the dean of the Université de Montréal Faculty of Nursing.
Mhm.
And I became the second one. We did have one or two francophone, but from other provinces because
Yeah.
we have francophone nurses across the country, out of Quebec,
Mhm.
and I was like, my goodness! And now I'm on this role since April 1st. It's an honor for me, and I always said, and even Friday when I was in Edmonton for a conferences about engaging, advocating, and leading, I clearly said to the audience, the student, and the nurses that leadership it's not about position. Leadership, it's about what you do in action. It could be
Mhm.
visible or it can be invisible sometime in
Mhm.
behind,
Yeah.
and leadership, it's not being a manager or being a president of any kind
Right.
of nursing association. It's what you do by your vision and certainly by your action.
Yeah.
And that's how where I am today. And I think it's because of my passion regarding engaging in the nursing profession, moving forward, not being in statu quos, reflecting on making mistakes because you can make mistakes,
Mhm.
and discovering, always new ideas and understand listening because
Mhm.
I don't talk much, I have to say, but I'm listening. I
Mhm.
listen.
Mhm.
Okay, makes sense. It makes sense. It not make sense, I would just not give a statement, but I would
Mhm.
ask question. That's
Yeah.
what I said to people. Instead of just giving statement, hash question,
Yeah.
and probably that's why where I am today. And I think
Yeah.
if I go back to what I said about Andre, my teacher my last semester in 1993, being you will go far away in the profession, and what I'm seeing now, I said, I think it's right. She got it right. But
Yeah.
I love what I do. Um, I always prepare myself, and I was always like that. When even the interview today, I prepared. I said, "I'm gonna have
Yep.
I'll prepare my thing because I don't know everything by heart,
Yeah, sure.
and I will try to do my best in this." Even in the same as president of the Canadian Nurse Association, what I find that I'm finding out that I'm president of two nursing reality, the francophone Quebec, I mean the Quebec, the province of Quebec reality,
Mhm.
and the rest of Canada, because Quebec,
Yeah.
because of its particularity, it's
Yep.
different in many ways.
Right.
And there are some differences in the nursing profession regarding the education, scope of practice,
Mhm.
and in different area, and
Right.
etc. etc. And this is even the governance, the way we process in a
Mhm.
meeting. It's there are similarities, but there are
Right.
differences because Quebec is regarding it's related more with the France code of conducting a meeting, and
Mhm.
Canada it's more regarding the Canadian parliamentary Robert's rules,
Right.
and for me, I have to say, and it's all in English, when
Yeah.
I'm meeting, when I conduct meetings in the rest of the country for CNE, and in Quebec, it's naturally in French. That's why for me, I would say it's quite challenging. That's
Yeah.
why I'm
I
trying to
can
do my
imagine.
best. Yes, I'm
Yeah.
trying to do my best. And I think, uh, you know, be who you are, be humble, be who you are. And yes,
Yeah.
I don't know
Not
where I'm going to be in 10 years. I
yeah.
hope I will be retired because I'm 56, but I don't know what I will do in 5, 6, 7 years. But
Yeah.
now this is where I am. And yes, sorry, I am talking, but I love what I do, as you can see.
Yeah, no, I mean, it's such an interesting time to be a voice for nursing, especially as you described, balancing the different cultures, the different languages,
Hmm.
the changing healthcare laws just to keep up with the pandemic obstacles that have, at least in this country, the
Yes.
different mandates we've had and lockdowns and quarantines and
Hmm.
putting nursing students on into practice quicker. And we've had so many different issues that have everything has been an upheaval from the pandemic. So to be a leader of an organization, like you said, that has two distinct cultural perspectives, I can only imagine the challenge that would have, especially for a self-described introvert. you know.
Yes. Yes.
Um,
You're right. You're right. Yes.
but one of the issues we have talked about more and more is diversity, equity,
Hmm.
inclusion within the nursing profession. Obviously in America, we had in 2020 with
Hmm.
George Floyd, race
Hmm.
relations became a very big topic of conversation again. And it brought the topic of disparities in healthcare here.
Hmm.
Um, how do you define or how do you demonstrate being a strong advocate for these type of issues, diversity, inclusion within the nursing profession?
But first of all, as I said earlier, I'm part of the diversity by myself.
Yeah.
As a francophone first,
Right.
but also be part of the I know all the acronym change over the years, but
Right, right,
LGBTQ,
right.
LGBTQ2 plus. Now I know it's two S. I think it changed.
Yeah.
And I always believe, since I'm in the nursing profession, even before that, we must contribute to inclusivity by being culturally sensitive and considering patient preferences,
Yes.
wherever
Right.
they come from, or whether they're black, people
Yep.
of color, indigenous,
Mhm.
LGBTQ also,
Yeah.
while providing proper nursing intervention. When you do intervention or you advocate for patients, wherever they are from,
Yeah.
color or whatever, you must work and understand who they are first.
Right.
You must also lead, being a role model. You must be a role model to promote inclusivity and equality in healthcare setting
Right.
by preventing the stereotyping. To prevent any kind of stereotyping of patient
Mhm.
and other nurses, because you do
Right.
have diversity among your colleagues.
Yeah.
You have to break down barriers by deeming harassment, prejudice, intolerance, and
Mhm.
racism is
Yeah.
unacceptable. You must make sure that you advocate for this also,
Yes.
because it's one of your social mandate.
Right.
And as a nurse, I've always cultivated an harmonious environment through awareness, acknowledgement, and acceptance of patient and nurse diversity.
Mm,
And I think that that's why it's important, first of all, that you have to make sure that the nurses, when they are educated, that you provide literature,
mhm,
and to make sure that they understand, encourage them to share their view,
mm,
giving them a voice because they have
right.
ideas to make sure that they understand,
Mhm,
provide opportunities to learn and develop by developing cultural awareness and
mhm,
competencies, as having the cultural knowledge,
right.
abilities, and skills to deliver care that is congruent with the patient's cultural belief and practices.
Yeah.
Because sometimes you can have someone, say, who are very religious,
Mhm,
and because in their culture or their religious belief,
mhm,
they can do that.
mhm.
But I think also that diversity in nursing is essential because it provides opportunity to administer quality and safety care to
Yeah,
patients who come from diversity or different culture.
yeah,
You
absolutely.
must also enhance your cultural encounter,
Mhm,
and I also strongly believe that cross-cultural interaction enable nurses to engage with
mhm,
culturally diverse clients or groups to change or challenge ethnic and different cultural bias.
mhm.
Developing your cultural skills, it's important because
Yeah.
it's help to assess correctly
Mhm.
the people you are taking care. Cultural
Absolutely.
desires, who refer to a more motivation and gaining desire for cultural, and you must understand
Yeah.
and engage in cultural desire can be manifested through openness to
Mhm.
cultural diversity and a willingness to learn from others. Me,
Right.
when I used to take care of patients from other culture, I always question them.
Mhm.
Why?
Right.
Because I want to understand,
Yeah.
you know, and that's why it's important that you become a culturally nursing competent.
Yeah.
It's important for transformational endeavor for all people,
Yeah.
you know.
Yeah. I
And
think as you said before too, you can't know everything, with your experience, and I think your patients can feel when you approach them with an attitude of curiosity and genuine concern for wanting to do things from a patient-centered approach rather
Mhm.
than, you know, not wanting to step on anybody's toes or say something politically incorrect. I think patients can feel the difference from you. So if you say, "I really don't know much about your culture, teach me." People are usually more than willing to share parts of themselves when people are genuinely interested.
And recognize also that you could have unconscious bias.
Oh, absolutely. Yeah.
And sometimes when you have recognized that you have unconscious bias, then you can work on it and reflect on it in order to move forward. And I would even just take an example, all regarding social determinant of health, will affect people differently.
Yeah. Yeah.
And that's why health organization and nursing must strive to adapt the healthcare delivery to meet the needs of a cultural diverse population,
Yeah.
and knowing that inequity affect health outcomes in a way, and both nurses and I would even say that the health care organization should strive to provide quality and safety care that will consider cultural diversity. This is, I mean, in today, even I would say even before, I
Yeah.
mean, it must be part of the nursing, and you must be aware of this.
Absolutely essential. Yeah. Tell us, you touched on before what your master's thesis was pertaining to. I'm definitely curious about that, but talk to us a little bit about the focus of your research. How has it benefited your healthcare system?
But okay, about my research, I will go with my PhD because the master's research, I don't work anymore on this
Mm,
area about men in nursing. Now it's focusing on human caring, because I don't know if you know Watson's human caring.
mhm,
Most of my research about it's about quality. It's about humanistic quality. About we talk about most of the a lot of research about talk about the quality of working life in nursing, but not much have talked about a humanistic way.
Mhm.
And I said,
Mhm.
through my research work, but I've published findings from my research. I also developed a new humanistic quality of work life model in 2015, and I published it in 2017. And it's based on human caring approach to have a more integrated view of the quality of work life. Because I think if then I think my research
Yeah.
my research but yes, I think also, but my research fundings have provided a lot of recommendation
Mm.
that we shift the way we organize the healthcare system from a bioman to a more humanistic approach. And
Right.
I think if you make sure that your environment is based on a humanistic approach, then you will gain some retention and people will have a quality of work life.
Exactly.
I mean, it doesn't make, and with what I've observed since so many years, that all the transformation, the reform have, in a way, dehumanized the healthcare environment. And when I'm talking about dehumanization, it's we see violence,
Mhm. Mhm.
racism, we see undecent, a lack of decent of working condition,
Yeah.
violence between nurses. I mean,
Mhm.
toxic environment.
Mhm.
I mean, I think it's time that we
Yeah.
humanize our organization, and I will
Yeah.
always advocate to get a bit what Brazil have done in the 90s, because the healthcare system didn't go well, and I think we need a national policy based, that will promote organizational humanization,
Mhm.
where people can work and self-care
Yeah.
and being comfortable to where you work. When you go to work, you don't want to be you don't want to work in a dehumanized organization. You want to
Sure.
work in a place that you can emancipate and empower yourself.
Yeah.
And that, for me, and my findings I've shown, and not just mine, Watson's work, Dr. Wolf in Pittsburgh, also Dr. Anne Boykin, and I could Dr. Cara in
Mhm.
Montreal University. I mean, all of those nursing research works have demonstrated clearly that if you work in a uh, humanistic environment, that will promote job satisfaction,
Yeah.
better nursing work condition,
Yeah.
and you will have time for yourself, and you will be happy to work. And I'm
Right.
sure that will be my probably next study, how humanistic organization can be we say a strive
Mhm.
to keep people and to retain nurses in the
Yeah.
organization.
Right.
Another area of research that I'm starting to explore, it's about uh, political nursing competencies. This is something
Mm.
because it came out. One of my team, from my team from my research finding, it's about um, political competencies,
Mhm.
abilities,
Mhm.
skills. And I
Yeah.
said there is something there, and I think nurses must develop these competencies, and just not develop it, but also use it and
Yeah.
express
Right.
it.
Right.
And I said, and I know sometimes nurses regarding politics, they think about to be a politician, but yes, it is in a way, but it's
Right.
more than that. It's more than,
Right.
and I have developed in 2021 with Chantal Cara, Dr. Cara, and Vincent Montreal. We have a chapter on this. It's a new model. It's called political caring literacy,
Ah.
and it's a how do we lead policy from a humanistic way?
Yeah.
You know,
Interesting.
being a humanistic ambassador, political awareness. Those are a component of my model, and how to be an emancipatory uh, person to
Yeah.
others. And how can we power not over but with people, and
Yeah.
shared also knowledge and that
Right.
is part the core of the political caring literacy model. This is a new model that could be used as a framework for nursing research. Someone would like to explore policy from a humanistic way.
Right. Yeah, no, I love what you say about that because I think a lot of nurses now can identify with that when you go into work in a profession where you're supposed to where you need to care and connect with people in order to do your job. You can't also go in with your guard up every day and at a high level of stress. It's just it doesn't match.
You're
So,
right. And I know sometimes people, when we talk about human caring or talking about humanistic or humanism, sometimes people say, oh, it's a concept, it's not realistic. But I said, it's all about relationship. It's all about collaboration, partnership. It's all
right,
about a healthy care environment. I
right.
mean, and how since 30 years, research on this area have
Mhm.
shown that we have evidence
Right,
that improve the healthcare environment.
right,
Why don't we go forward with this?
right.
There is two school of thought, but me, I'm on the school of thought who think that having a humanistic workplace improve the quality of work life. I
Yeah.
mean, my results have shown it, and
Mhm.
others too. But people would say, "Oh, Sylvain, it's obvious." Yes, but it doesn't seem obvious because what we
Right.
see right now is the dehumanized organization. Even I would
Yeah,
say disorganized
right.
healthcare environment.
Yeah, I think people are paying a lot more attention to healthcare systems than they ever have before and realizing the products that come out of healthcare systems and how it directly affects your quality of working life, which
Hmm.
affects your home life and your work-life balance. So I think a lot more attention is being paid to connect the theory world of nursing with the actual, bedside care that
Hmm.
goes into it. So it's a good time, I think, to capture people's attention for how it really does relate to their everyday life, and
Yes, yes.
experiences. Talk to us. You've taught all through COVID. What are some of the academic challenges in nursing education? Both as a response to the pandemic, and also how the quality of nursing education was maintained during periods of quarantine and lockdowns, and where students didn't have access to real breathing people.
Mm-hmm. I have to say that, yeah, because I was when the pandemic arrived at my university, I was the director of the nursing baccalaureate program.
Mm,
I have to say it has been a challenges to make sure that the student that we are providing courses, theoretical courses and training
mhm,
and simulation at the lab has still have that they gain competencies, through the
mhm.
education. It was a challenge because we have to review our simulation because we cannot be in person
Right.
in the lab. Now how can we do? And we went to the Canadian Association for Nursing School, who were very
Mhm,
partner with us, that they work a lot to create simulation lab virtually,
mhm.
but it was a challenge.
Yeah.
And we developed these to make sure that the nursing students are prepared to go into practice, and it was a challenges, and all the placement was difficult. We have
Yeah.
to stop all the placement, the training continue,
Mhm,
but more virtually. I mean, it doesn't
mhm,
make sense. The student who was inside the training practicum, in the hospital, were afraid to
mhm.
catch the disease. Oh
Of
no,
course,
it
yeah.
it, it was a challenging for us. I was working like 12 hours a day, to support my colleague.
Yeah.
Sylvain, how do we do that? Because in my career, yes, I've been a nurse bedside. I've been in community health. I also work as a nurse in infection prevention control
Mhm,
for five
mhm.
years. Naturally, this experience helped me to make sure
Right.
that we respect all
Yes.
the
Take it
measure,
seriously.
the yes, and the sanitary measures. And no, it was a challenges, but we know, and we said clearly to our partners, stakeholders, hospitals, say, here where there is a lack, and here where we have tried to increase the learning and make sure that the nurses are prepared to face the reality of the complex of the healthcare system. We
Mhm,
knew it was not perfect, but we list it, we send it to them to make sure that because when you finish and you arrive in the hospital, and make sure that they can continue the transition and make sure that the students are prepared.
Mhm.
But it was, like providing a transition for
Right.
new grads, and a bridging, for to make sure that they practice in
Yeah.
different area, and make sure that they can make sure that they have the tools in their bags to
Mhm.
be able to practice as a nurse.
Right.
But it was a challenge time, I have to say. It was very
Yeah.
difficult. It was a challenge time. And now that, but we're still in the pandemic, but to increase the seats a lot, we have made we advocate the Canadian Nurse Association for Education and Training. We have, to increase the system capacity for education and
Mhm.
nurses and health workers. We have advocate for now. We advocate for funding the expansion of seats in nursing school, because we want
Yeah.
to stop, the bleeding.
Yeah, right.
Funding, yes, funding. I mean, bleeding of shortage of nurses.
Yep.
Funding should address the shortage of faculty, also clinical teachers,
Mhm.
and increasing capacity for clinical placement,
Right.
new simulation learning, new innovation
Mhm.
in simulation, and also a preceptorship program that we have to reinforce.
Yeah.
I would say also funding the expansion of seats in nursing school. This
Mhm.
is important, and also funding for professional development that would help to retain nurses. I think
Mhm.
that the school, you know, in a way, yes, we have the nursing program, but we're trying to have other, like, continuing education development that could be helpful for the one who didn't have all the tools that they were supposed to have to start the practice, because of the pandemic. It
Mhm.
was it has have an impact on in 2020 2021 for
Mhm.
the student who start to work
Sure.
as a nurse. Yes, and I think
Yeah.
we must, and the organization also must work with universities to make sure that they have all the tools, all the knowledge, all the abilities, the skills, the competency to work to make sure that they can work as a bedside nurse.
Yeah, no, that's well said. I mean, nursing, I think, has been part of the mainstream conversation for the last couple of years now. So a lot of issues that
Mhm.
many people wouldn't have been aware of before are now aware, which a lot of those messages are negative, about the trials and tribulations that nurses have to endure. For future nurses that are coming up, what is your best message to encourage them, accelerate their passion to keep pursuing their nursing careers, despite what they might be hearing on social media or the
Mhm.
news
Mhm.
feeds?
I would say, first of all, you're a nurse. Nurses are some of the most trusted professional
Right.
in Canada, in the world,
Hmm.
and that their voice carry weight and are considered ethical, honest, and passionate. They are very patient-centered,
Yeah.
but I have to say to them, they must be involved in nursing governance,
Yeah.
have the opportunity to have their voice heard and impact outcomes, because they
Yeah.
can
Right.
impact outcomes, and also impact on the determinant of health, climate change, and
Yep.
even also the evolution of the nursing profession. And
Hmm.
as a younger generation, because I'm more like, not a baby boom, I'm more like Generation X, but we have to listen to the nurse. And I have to say to them, network with your local and national nursing association. This
Yes.
is, nursing council, nursing union, or even your regulatory, a bit of what I have done. And I would even say, go to your municipal board, bring your nursing lens, because you have a unique view of
Yeah.
different things like work-life balance, organization, and as a nurse, you can express, yes, individually or collectively, your nursing leadership, and it could be visible or even invisible, but
Right.
but you are doing something,
Right.
and network, enhance your leadership to improve the quality of life of people, influence the change also, because you are well prepared. To my knowledge, you are
Yeah.
well prepared to lead that charge, I
Yeah.
think,
I
and
agree.
participate in leading policy development, because if you don't participate, it is someone else that is not a nurse who will decide for you.
Yeah, true. Very true. I think the more nurses we can empower will help with that feeling of helplessness and burnout and things
Yes,
that so many nurses are experiencing right now.
and take care of themselves, because if you
Right.
don't take care of yourself, who will take care of you?
Right. Yeah,
And
for
in
sure.
order to take care of others, it's important.
Yeah, absolutely agree. You've been engaged with policymaking, governance, and nursing for some time. What can you say about the current working conditions for nurses? And do you think there's anything that can be done to help them in real time as we kind of are at the tail end of, we hope, this pandemic?
But I have to say that, as you know, across the world, nursing working condition, but naturally, it was it have deteriorated even before the pandemic. It was there,
Mhm.
and the pandemic, what that the pandemic have done, it have put it, it's amplified
Yes.
this working condition issue.
Right.
It's exacerbated, and
Hmm.
and you know, nothing has been done over the last 2 decades to improve the nursing working condition and work environment. And
Hmm.
now that what we see, it's a shortage in some places. It's a shortage of retention,
Hmm.
because if I'm just looking at here, well, some provinces will have the short age, it's inside the province, and some province it's not inside the province, because we do have enough nurse. It's
Hmm.
inside the healthcare system. It's
Hmm.
like if it's a short age in some places, it's not everywhere, because I'm not
Hmm.
generalizing. It's a short age of retention among nursing profession.
Hmm.
And when you see 82% of nurses report that current staffing is not sufficient to safely provide care,
Right.
and 70% says the workplace are regularly over capacity, according to
Yeah.
the Canadian Federation Nurse of Union. I mean, we have a problem. And even
Hmm.
what we observe, according to some report, in some hospital setting here, one nurse is taking care of 10 patients, even
Yeah.
sometimes 15 in
Right.
a medicine or surgery unit. It doesn't make
Right.
sense.
No.
And we know that, according to studies, in ideal conditions, one nurses will care for 4 or 5 patients.
Right.
Bon, in ICU and emergency, it's one, sometimes two, but it's better 1 to 1.
Yep.
But you see, I mean, this is an example,
Absolutely.
and many have faced 16-hour plus shift. It doesn't
Yeah.
make sense.
Right.
Overtime mandatory, and I mean, Quebec had overtime mandatory since 1997.
Wow. Yeah.
I mean, doesn't make sense. That's
Right.
why we need shift. And when we ask nurses, I mean, they feel pressure.
Mhm.
No, you know, I think it's time that we have a shift, because I mean, because of the nursing short age, nurses are
Mhm.
facing unbearable workloads and unsafe
Yeah.
working condition.
Right. And
And,
here in the
and
States, they're being prosecuted and put in jail for their mistakes. It's
yes,
not
yes, I
just.
know that. And,
Yeah.
and, and I mean, it doesn't make sense.
Right.
And what's happening? But they are leaving the organization and work
Mhm.
in other kind of area that are more acceptable,
Yeah.
or they will quit the profession. And even the
Altogether.
younger,
Yeah.
after 2 years, they say, what the, and then what they do, they leave the profession.
Yeah. Right. It's true. I'm gonna change gears a little bit here.
Hmm.
I want to hear more about the Canadian Nurses Association. We talk a lot about the benefits of joining organizations here in the States.
Hmm.
Can you tell us a little bit more, the Canadian Nurses Association, the purposes, the goals, mission statements? Why should nurses join the Canadian Nurses Association?
But first of all, I have to say that the Canadian Nurse Association, but first of all, exists since 113 years,
Yeah.
is the national and global professional voice of Canadian nursing, and we represent not just the registered nurse, we represent also the nurse practitioner,
Mm.
licensed and registered practical nurse,
Mm-hmm.
registered psychiatric nurses, but we do have this role in west of Canada,
Mm.
retired nurse, and nursing student across all
Wow.
13 provinces and territories.
Amazing.
And as a national and global professional voice of Canadian nursing, advancing the practice of nursing and the profession to improve the health outcomes in a publicly funded non-for-profit health system by
Mhm.
unifying the voice of nurses because it's
Mhm.
important that because we know that we are strong
Yeah.
together, strengthened nursing leadership and even clinical nursing leadership, promoting nursing excellence and as a vibrant profession, advocating for healthy public policy and
Mhm.
quality health system and serving the public interest. We also promote the role of nurses by ensuring their voice is heard when key
Mhm.
decisions are being made about how healthcare is delivered in Canada.
Right.
CNA speaks for Canadian nursing and represent the profession to other organizations and to government
Mhm.
nationally and even internationally. And we give nurses a strong national association through which they can support each other and speak with one voice.
Yeah.
Because we know that if
Yeah.
we speak by one person, it's not enough. We must be together. And CNA is a key player on the federal and provincial committees, coalitions, and roundtable. And why we should join CNA, get access to knowledge and leadership resource, had their voice and support nursing advocacy, as I said earlier,
Mhm.
influence the movement of nursing internationally through CNA membership with the International Council of Nurses,
Mhm.
enjoy naturally inclusive saving membership, also being membership of the Canadian Academy of Nursing, because we do have this now in Canada as you do in the US with the academy what is the Academy of Nursing, American Academy
The
of
American
Nursing.
Association
Yes,
of Nursing.
yes, we do have the Canadian Academy of Nursing, opportunity to attend exclusive event, full access to the Canadian Nurse online journal, and
Mhm.
access, this is new, to CNA exclusive online community of practice in different
Yeah.
area. And we have to end with this too, with all the structure that we have changed over the last 2 years. Now we have six councils
Mhm.
that do recommendation to CN, to the Canadian Nurse Association. Indigenous
Yeah.
Circle, Indigenous Nursing Circle, Francophone Council of Nurses,
Mhm.
specialty nursing advisor, and we have also anti-racism. We have a anti-racism council
Yeah.
of nurses. That and they and also the future of nursing, and they give advice on different kind of issue related to their area. Uh, if it's racism or if
Right.
it's regarding the indigenous, and they are our expert on these different councils,
Yeah.
and they give us information. Okay, we must work on this, we must work on this. And this is, I would say, it's a brand new, it's already been brand new in our governance structure, and it's a, I would say, an innovation that we put forward and I would say on the last year that we just finished.
Yeah, incredible. Incredible. You guys are doing so much work in so many different areas. It's amazing the reach that you have, and the accessibility for nurses to join. At Nurse Tech, we talk a lot about community, the importance of community and belonging somewhere where you feel validated in your experiences. How do you think nurses can benefit from either our community or just belonging somewhere where they're really heard?
Nurses want to be in a safe space. They want to be able to talk, to
Yeah.
discuss, dialogue. I always say, be part of it. That was on my speech in 2020 for the president-elect. I said to the nurses, for me, to my point of view, nurses must be part of the dialogue, decision, and action
Hmm.
in order to
Yeah.
transform the healthcare system.
Yeah.
And that's mean engaging, leading, and communicate,
Hmm.
sharing knowledge, enhance the networking, as I said earlier, uh,
Hmm.
um, uh, discuss on different nursing topics, be part of community of practice such as
Hmm.
clinicals. If it's you are a manager, then in management, even a nurse that is not in management could be part of
Hmm.
it. Research, nursing policies, and naturally education and governance. And I
Hmm.
think that's giving tools, uh, uh, um, that they will use in the community after that,
Yeah.
and changing the role of healthcare and nursing profession, you
Yeah.
know.
Absolutely.
And this is by providing a vast area of knowledge, resources to the community nurse. And I think that's it is important. And as I said, using your nursing voice, your nursing lens when you
Hmm.
are on the table. And I know some nurses doesn't want to engage for different reason, and I respect that. But I think
Hmm.
it's important that we are on the table and we put our competencies, nursing competencies, to the service of the decision maker,
Right.
and for the nursing profession, but also for the health of the population. You know, to be a nurse, as I said earlier to the interview, it's not a job, it's a professional work.
Hmm. Hmm.
You know,
Yeah.
lead. And I would end with this. uh, we must invest in nursing, and
Hmm.
invest in nursing, it's
Yeah.
investing in the healthcare
Right.
organization, because don't forget one thing: nurses are the backbone of the
Yeah.
healthcare system. No
Absolutely.
nurses, no nurses, in respect to other profession, no nurses, sorry, but it's no healthcare system and no
Yeah.
services.
Yes, I 100% agree. Very well said.
Yes.
Um, well, I've loved getting a glimpse into Canadian nursing. We definitely have some Canadian nurses as part of our organization. But even just for people that aren't familiar, it's you've brought up some incredible topics that are just relevant to anyone, anywhere, any nurses working anywhere right now, especially through the pandemic. We always like to leave off if you have a message for future nurses, seasoned nurses, the ones that are about to retire, any nurse watching or listening or reading these words, what message would you like to leave them with?
Oh my God, I have so much. I have to use one
Your
sentence.
favorite question.
Yes, using your nursing voice wherever you work, wherever you are retired, student, you
Mhm,
work in community, acute care, whatever.
mhm,
Use your voice. And I would say, you know, investing in nursing is investing in health and economy, and as
mhm.
well as strengthening health system
Yeah,
wherever you practice across the world,
yeah,
because you can lead and you can advocate and you have the leadership. Now
right.
it's time to go to apply it.
Yes, yes, love it.
Do
Perfect.
it. Make a difference. You can make a difference
Yeah,
more than you can think.
yes, yeah,
Yes.
very,
Be
very, very
be
true.
visible, be visible. And you know, it's all sorry, I'm
No, that's good.
it's all related to the image of nursing. We are not, first of all, we are not angel, that the word that I don't like, and
Mhm,
we are not guardian, that because our prime minister said no, no, we're not angel, we are nurses are scientists. And
mhm.
when they intervene, they always intervene, their intervention is grounded to scientific knowledge. We
Right.
are scientific and we
Yeah.
are nurse scientists. That's what I would say to the nurses across the world, and in Canada and in the States also.
Mhm. Yeah, perfect. Well, thank you so much for giving us your time and all of your thoughts. I can tell you're a very busy person with all the work that you're doing, but we're
Thanks.
so lucky to have you globally in the profession and advocating for us. And I know people will be following your career as well. We will definitely give people the information they need to be in touch with you and the work
Thank
that
you.
you're doing. So
Thank you so
thank you
much. And
so,
thanks.
so
It
much.
was really an honor and a privilege to be interviewed by a colleague, because you are a colleague for me.
Yes.
Thank you for the work you do. Thanks.
Appreciate it.
Thank you.
Talk soon.